Welcome to this episode of Testable Faith. My name is Rana. I'm a biochemist and a Christian apologist, and I'm joined in studio today by Dr. Christina Cirucci, and we're going to be discussing the question, is gender-affirming care ethical? Chris, thanks for being with us.
Thanks so much for having me, Fuzz. It's great to be here again.
Yeah. So we're going to be talking about really the question of medical ethics and how it applies to gender-affirming care. Maybe a place to start would be very quickly, just in a nutshell, what is gender-affirming care?
Right. So the term gender-affirming care, is a approach to treating people with gender dysphoria, people that don't feel comfortable in their birth sex and want to be a different sex, usually the opposite sex. So in gender-affirming care, the diagnosis is actually made by the patient, and the physician affirms the patient's chosen gender. They're actually obligated in that model to affirm their gender. So a young girl who goes to the doctor and says, I think I'm a boy, the doctor says, yes, you are a boy. Here's your testosterone. And I make it sound like it's pretty quick, but often that's how people describe it. So rather than delving into a lot of what's in the background or what may be going on, it's affirming the person's gender.
Right. And there's more to it than that, because once you affirm that person's gender, there's then active medical intervention to help that person transition to some degree, so that they begin to adopt the physical appearances of the gender they imagine themselves to be.
Correct. Yeah, we often we've talked about this before, where there's kind of 4 steps, so to speak, and not everyone does all of those, but the first step is social transition, where the person would take on the name and pronoun and hairstyle and clothing of the gender they desire to be. The next step, if the person is young and has not gone through puberty, is puberty blockers to block their normal physiologic puberty. And then the next step would be cross-sex hormones, taking hormones of the opposite sex to appear and have the secondary sexual characteristics of the opposite sex. And then some people go on and have the surgery.
So then the question that's on the table is gender-affirming care ethical from a medical standpoint? So when it comes to medical ethics, what is the model that most physicians, or hopefully all physicians, adhere to?
Right, and we were taught this from early on in medical school. There's 4 principles typically of medical ethics. The first is, we call it beneficence, but it basically means do good. So do good to the patient. If something doesn't benefit the patient, that's not ethical. Yeah. The second principle is a long-term non-maleficence, means do no harm, and we often say do no harm. So I can't always help the patient, but I cannot, should never do anything that would harm them or could harm them. The third principle is autonomy. The patient has the right to make their own choices to refuse treatment or accept treatment. And the fourth principle is justice, meaning I must treat, as a physician, must treat all people equally, give the same level of care to every person.
Yeah, so then the question on the table then is gender-affirming care ethical? Does it meet this particular set of standards? So, Chris, when it comes to social transitioning, how does that step in the gender-affirming model hold up to the standard of medical ethics?
Right. So, and I've looked at each step with each of those principles of medical ethics, and I would actually, it is my position that certainly those first 3 principles of medical ethics are violated in gender-affirming care. So again, do good, don't do harm, and patient autonomy. And so in social transition, now that may be something that a person does on their own without intervention. So, obviously people can do what they want. If somebody wants to dress a certain way, that's their choice. But for a healthcare provider to encourage that. There are harms to social transition. You know, some girls will do something called chest binding their breasts and really tight. It, often side effects from that, shortness of breath, back pain, things like that. And so there are harms. Are there benefits to that? We have no evidence that there's any benefit. So I would say, you know, social transition, and maybe we can even go through the ethical things one by one, if that would be okay.
Sure.
So if we think of, again, the first, do beneficence do good. So when I have a patient come into my office and I give them a treatment, I need to be sure that there's obviously things don't always work out, but that there's evidence that this is going to benefit them. Yeah. So the question then becomes, is there benefit to gender-affirming care? Is there benefit to social transition, puberty blockers, cross-sex hormones, and surgery? And actually, the data doesn't bear that out. Yeah. These studies that show benefit have significant limitations. They're often on a different population than we see today. And so we don't have evidence that there's benefit from that. Unfortunately, you know, these young people are struggling. They are looking for help. And they may go into this thinking there's benefit, but the evidence doesn't bear that out. So is gender-affirming care beneficent? Does it do good for the patient? We do not have adequate evidence to show that.
Yeah. Well, what about the criteria? Yeah, do no harm.
Do no harm. So do no harm, and we often think of this in medicine because sometimes we just can't. You're tempted to just do something, and you that would be non-ethical to do something just to do something, but we really can never, as a physician, I don't ever want to harm my patient. So any intervention, we want to make sure that the risks outweigh the benefits. And so does gender-affirming care cause harm? Well, social transition, actually, there can be harm to that, and as I mentioned, but it also typically sends them on the next path. And puberty blockers typically send them on the next path. But puberty blockers, yes, these are a hormone, or anti-hormone that stops their normal process of puberty and can cause bone loss, and there may be cognitive changes, permanent sterility. You know, the medicine we use for they use for puberty blockers, as a gynecologist, I use for certain things in women, like endometriosis or fibroids, and we typically only give it for 6 months because of the adverse effects. But yet a child going on puberty blockers will be on it long term. So yes, there are harms to puberty blockers. And then are there harms to cross-sex hormones? Yes, so we're talking about taking a hormone of the opposite sex. A girl who takes testosterone, yes, increased risk of heart disease, high blood pressure, liver dysfunction, et cetera. A boy taking estrogen, much higher risk of clots, heart disease. So these, there is harm.
Right.
And then surgery, we could go into more detail on that, but these surgeries are fraught with complications.
Yeah. So then, you know, what about this idea of autonomy? Because it seems to me that on the surface, you might argue that this is something that is not problematic for gender-affirming care, but you would disagree with that.
I would. So autonomy, right, it sounds like kind of gender-affirming care sounds like, well, isn't that the patient's autonomy? But what autonomy means is that the patient can choose to receive the care or decline it. But in order to do that, they have to be given the information. So if I'm going to do a surgery on a patient, I'm going to do a hysterectomy, for example, on a woman, I'm going to tell her what I'm going to do, the advantages, the expectations I have, and the benefits, the risks, the other treatments. So she needs to understand that, and she could say, yes, I want it, or no, I don't. But that doesn't mean that a woman who doesn't need a hysterectomy can just come into my office and say, I want a hysterectomy, because that would not be doing the right thing for her.
Right.
So autonomy means a patient can accept or refuse a treatment. It doesn't, and it means they need to be informed about what that means. It doesn't mean they can just have any treatment they want.
And so the concern then is that for gender-affirming care, a lot of times there are these perceptions about gender-affirming care that don't match reality.
Yes, and I think, kids have said they expect this to solve their problems, and it doesn't. If a lot of people suffering from gender dysphoria suffer from mental health conditions and a history of abuse or trauma, and this isn't a fix for those things, and we need to do. As a physician, patient comes in my office, I want to do the right thing. Gender-affirming care isn't the right thing.
Yeah. So, what would you say, just as someone who's a Christian, to a patient that wants to have gender-affirming care, right? And then maybe what would you say to the medical community that seems to be advocating gender-affirming care from a Christian, as a Christian?
Yes. So to the patient, I would just want to say and affirm them actually in the sex that God created them to be, and that they're fine how they are. And I don't mean that to say like, oh, you don't have any problems, you're not struggling, but they don't need to be someone else because they can't. And God made them how they are and loves them as they are, and they're created in the image of God.
Yeah.
To the medical community, I would say I am appalled and really angry that my colleagues are doing harm to children. And, I hope, and probably most of them really believe they're doing the right thing. But as physicians, we have responsibility to look at the evidence and look at the data and make sure that what we're doing is benefiting our patients and not harming. That doesn't mean there's not risks, but you always have to make sure the risks outweigh the benefits outweigh the risks.
Yeah. Well, I appreciate that, Chris. Thank you so much for being with us to talk about this question about